about putting that in the show today?
Absolutely. I really like that. But how did you come up with that?
I was just thinking about what's the best way to serve the guys today on the MD and Chef Team show.
Yeah, and I was thinking, what about adding something like this to one of the pillars, just to empower, to equip them?
Beautiful. Oh, and may I say, speaking of beautiful, you look exceptionally gorgeous today, my dear.
Thank you, Ben.
Oh my gosh, I just noticed. I think it's time for the MD and Chef Team show.
Yay! Let's go!
The content in this show is for informational purposes only. It is not intended for medical advice. It does not take the place of medical advice or treatment from a physician or health professional. Listeners and viewers should consult their own doctor or a qualified healthcare professional for specific health and wellness concerns and questions. And now, let's start the MD and Chef Team show.
Hello and welcome to the MD and Chef Team show. I'm your culinary nutrition expert, Chef Michael, and joined by my beautiful hottie bride,
Oh, babe!
Dr. Isabel. You are Dr. Isabel, my Isabel.
Isn't he the cutest?
How
Well,
you
I
doing
think
today?
he's the cutest.
Yes, great to see you today. I hope you're open to some live conversation, some live chat, some open conversation. We're here to have a conversation with you about all things around brain health and other related matters. We'll talk about the more specifics in a little bit. But, I have a question for you, my dear.
Yes, dear.
So viewers out there might be wondering, yeah, okay, here's these guys, the MD and Chef Team show, Michael and Isabel, la-di-da, but why should I tune in? Why should I bother? Why should I come back? That might be their question.
Why, you
What
ask?
would you say?
Well, I would say, hey, you know what? I have seen where you and your family and your friends could end up. And I want to give you a new pair of glasses. I want you to open up the window and look into your future and realize, you know what? You don't have to end up like everybody else is out there with all this chronic disease like anxiety, depression, type 2 diabetes, that's reversible. Alzheimer's, that's preventable and even reversible in early ages. High blood pressure, obesity, you know what I love about this is that I'm grateful that I've seen what I've seen. And it's kind of like Christopher Columbus. You know how everybody's like, the world is flat. It's flat, flat, flat. And Christopher Columbus was like, no, it's round and I'm going to prove it to you. Healthcare is changing now. The paradigm in healthcare is changing. We're not all about what's the diagnosis. We're now, hey, why is this happening and what can we do to prevent it and even reverse it? And from my personal experience as a suicide survivor, as a medical doctor 10 years ago, dropped into the sea of mental health in medicine, and I survived it. And I was like, wow, we got to figure this out because people are suffering out there. Yeah. And from the research, the most latest up-to-date research, and from our experiences, we've realized that we're focusing on the wrong thing. We really don't have a mental illness issue. That's the downstream event. We actually have an upstream event. We should actually be focusing upstream, which is our brain health. When we learn how to take good care of our brain health, like gut health, nutrition, sleep, dealing with past traumas, all that stuff, and so much more. When we learn how to support our brain health upstream, we don't have the downstream event. And it's kind of like, I always say, it's kind of like mopping up the floor. What we're doing in medicine right now is we're mopping up the floor because it's full of water while the sink is overflowing, instead of just going upstream and turning off the faucet. That's what we're doing here. That's why I want you to listen. That's why we want you to listen, is learning how to turn off the faucet so you don't have the downstream event. And so I just encourage you to stay here with us. We're not going anywhere. We are not going anywhere. We're here week after week. We are your hangout place. We got the roadmap. We've been doing this for the last 10 years. You know, we got skin in the game. We know how painful life can be when you've got the downstream event happening. We got the roadmap, and we want to walk alongside you and encourage you and strengthen you both emotionally and physically and spiritually if you're open to that. And you come to the table and take small, consistent steps. We're not asking you to take big steps, just small, consistent steps.
And it's a real paradigm shift in our thinking, not just individually, but as a society where traditionally we're just thought, well, oh, I'm just getting old, or I'm just forgetting things. It just comes with age and all this kind of thought processes. And, oh, well, my parents had that so I'm going to have it. All those thought processes, and they're not true. And so there's a massive paradigm shift in healthcare and in medicine today where it's coming. There's a big shift coming, and we're part of that shift. But we all need to kind of start looking at that as ourselves individually. Like,
and wake up.
Right.
Because it's very silent. And I didn't mean to interrupt. But
you said wake up.
But, it's like we got to help. We're here to help you wake up to what's possible, because you're not going to get this in your doctor's office. They're not teaching you this. They don't have time to teach you this. And you know what? A lot of medical doctors don't know about this because they're busy trying to keep up with the insurance papers and all the paperwork and all that stuff. And I didn't mean to.
And they're overwhelmed.
I didn't mean to.
I mean, I had this conversation yesterday. I was playing golf yesterday, and there happened to be 6 guys. We were in a couple groups, and there were guys I didn't know before, but at the end, we sat down afterwards. I had a coffee, they had a beer, and they were talking about different ailments. Hey, thanks, Rubio. They were talking about some different ailments they had. And one gentleman started talking about his doctor visit because he had some gut health issues. And he said, I was there for like 10, 15 minutes and was talking about it. And then he said, okay, well, that's all the time I've got. Hey, maybe try this. And he gave him a prescription for some different pills. And he just thought, I've had this going on for a while, and that's all I got. And he started questioning, and then he didn't know what we do. And I said, well, have anybody suggested to you about doing a complete microbiome test to take a look at what's going on in your gut for all the different, microorganisms that are happening and can be out of balance?
Tell them what a microbiome test is.
Well, a complete microbiome test is going to take a look at all the different, with a microbiome,
test.
We have good bacteria, bad bacteria. Are they in balance? Are they out of balance? Could there be parasites? Could there be bacteria? Other things going on in our gut health? What could be out of whack? And you can see the headlights of all 5 guys be like, huh? What are you talking about? And so we had a really good conversation about starting to understand that that's why we talk about it. And again, I'm going to bring out the title of today's show. It's about taking back our health, because what we've done and what we've gotten into the habit of is just handing it over and saying, here you go, medical profession. Here's my health. Go ahead and fix it for me. We have to understand, we've got to take back our health. We have to start asking. I said to these guys, you got to start asking the questions, the hard questions. Okay, you've told me I got this, but how did I get this? I didn't have it before. Now I'm here. How did I get here? And I want to get rid of it. So what do I got to do to get rid of it? Not like, okay, well, this will make you feel good for the next couple of weeks, but I don't want to be here anymore.
I want to solve this problem.
Yeah. And so that's the paradigm shift of not what is the disease, but why is the disease? Yes. And that's what we're all about. And so hopefully if that resonates with you and you go, hey, I like the sound of that, we'll
stay with us.
That's what we're here
for the rest of your life.
And hopefully that's many decades.
Years. Yeah.
Hey, so let's see. What are we going to talk about today? What could be? Do we have? Oh,
thank you, Jenna. Just so you know, Jenna's our producer. She's backstage today. She's not coming out today, but we love her and we thank God for her.
And we can't do it without her.
Cannot do it without Jenna.
So today's conversation, we're talking about, are you ready to take back your health? And we're in part 2. So if you missed part 1, well, episode 21 from last week, a week ago this time, you can go back, check it out and see it. So we're going to get into that. We're going to talk about creating a sleep sanctuary.
Mm-hmm.
Also, the other biggie today is obstructed sleep apnea. What is it? What's it all about? What can we do about it? We had some great questions last week from gentleman AC wanted to know about it. He was talking about snoring. We're going to talk about that today. We're going to have a big take home today. Please hang around for that because that's going to be very, very important. We got something huge there. And then later on, the relationship chat. We're going to continue this relationship chat that we had about men and women are different, that Isabel's going to be bringing some insights from the medical profession about how men and women are different.
We're going to take a deep microscopic look at how we're different.
And if we get a chance, we'll get to some empowerment conversation, what's called the midnight hour. Who knows if we get there? We might.
Who knows?
We'll see what happens. So now, if you've got comments and questions, then just put them in the chat and we will look to address those after the breaks. We're going to take a couple commercial breaks during the show. And so put your comments and questions in. Comments, yes. If you got specific questions, put them in there and we will address them after the breaks. And hello, everyone that's popping in wherever you are. From wherever you are in the world, we appreciate you being here today. Thank you for stopping by and allowing us to come to you. All right, my dear. So what do you think? What do you got?
So let's get back to, I wanted to just quickly, like in less than 5 minutes, how to create a sleep sanctuary. Because you're asleep a third of your day, hopefully. And so you want your bedroom to be the best. And so I just want to give you some ideas. One is keep technology out of the bedroom. Please, no TV watching, no iPad, no phone, no technology in your bedroom. It affects your brain connections. It keeps you wired and awake, and you don't want that. You want to be calming down and getting ready for sleep. So no screens, no phones, no tablets. And you can say anything you want anytime you want, babe.
No, that's perfect. Okay. Exactly.
You're a good listener, but it's okay if you say, hey, what about this? And hey, what about that? Okay.
I will.
All right. And then the next is comfortable mattresses. So make sure it's not moldy. How do you know if you got a moldy mattress? Well, if you've been sleeping in your mattress for more than 5 years, you're at high risk for having a moldy mattress. If it's ever gotten wet, you're at risk for a moldy mattress. If it smells musty, you're at risk for mold in your mattress. If you see any green on your mattress, then that's mold. Mold is not good for your brain health.
No.
And I will promise you from the bottom of my heart that we will have like a 4-part series on toxins and how we're exposed to certain toxins, and mold is one of them, and how it affects our brain health and can lead to anxiety, depression, and even dementia. Okay? But not today. I just wanted to plant that seed.
We can't cover it all today.
Well, we could, you know what we could do? We could do a 72-hour marathon.
72 hour. Hey, Jenna, producer Jenna, can we just hang on here for 72 hours and make this a marathon?
The answer is no. I know. Jenna says, I know people who have mattresses for 20 years. I know. Yeah, I know. It's pretty sad. That's why we're talking about a sleep sanctuary. Okay, comfortable sheets, cotton, bamboo, silk, really nice. Comfortable pajamas. So you don't want any seams that get caught in, those places. And you don't want any waistbands that are digging into your skin. You want to have smooth fabric without anything that's constricting.
Nice silky pajamas.
Yeah. Or you can just sleep in the nude.
Yeah.
I personally have a tough time sleeping in the nude because I'm always thinking, what if we have earthquakes here in New Zealand? And I would be oh my gosh, I would be so afraid if we had an earthquake and
everybody out.
And I don't have time to get dressed. But just so you know, next to my bed, I do have my shoes and my light, just because in an earthquake, here we go. So in an earthquake, the walls, the windows break, and so they're shattered glass. And as a medical doctor, I know, because I've taken care of people after earthquakes, and they're walking on glass, and I have to pull the glass out of their feet, and hell. So I'm not going to have that
I
happen.
know,
That's why I've
I
got
know.
my shoes. I know too much.
I don't know. Yes, earthquakes are tragedies, but I did have just kind of a funny thought when you're talking about that. I mean, if we all slept nude and there was an earthquake and we just threw on our shoes and ran outside with our flashlights, and we're just showing our flashlights around at each other with shoes on. Yeah, okay.
That could happen.
No.
That's why I don't
Yeah,
sleep.
probably not.
That's why I don't sleep in the nude. Now everybody knows. Okay, use furniture made of wood, plastic, leather, or vinyl, including vinyl mattress covers so that you can wipe them down. That's really good. You want to make sure you're dusting at least every 2 weeks because you don't want dust to accumulate because dust can cause allergies and can also block up your nostrils so you don't get oxygen into your brain. And we want lots of oxygen going into our brain. And the optimal temperature is between 19 to 20 degrees centigrade, which is about 68 Fahrenheit. And you want darkness. You can get dark out curtains. So those are blackout blinds that you can use, or you can use glasses,
Yeah.
Something soft though, not
Yeah.
tight. And then quiet or calming music.
If you need music.
If you need music. If you need something, if you need white noise or something.
I think there's a lot of apps these days that have lovely little sounds in the background and all those types of things. If you need something playing or a white noise or something like that. Yeah.
Good. And Jenna says she vacuums her mattress. Good job, Jenna.
Yeah.
And then nice smells, essential oils, and a diffuser on the flannel. I have lavender oil with some and in a spray bottle and spray it on our pillow every once in a while. Have you noticed?
Yeah, it's nice.
Good.
Yeah.
And then we turn off the Wi-Fi at night. Why? Because if you don't, then you are like, your brain is like a radio tower, and those electrical magnetic frequencies are pinging through your brain and keeping you awake and disrupting your sleep. Okay?
Yeah.
All right. Let's see what else. Okay, so now that was sleep. Now we're going to talk about obstructive sleep apnea.
And I will say, if you wanted more on the main part of that talk leading into that part of sleep, go back to last week's show, part 1, episode 21, and it was all leading up into just that short part there that you filled in for everyone, okay?
Mm-hmm. Thanks.
Just to keep everybody in the know what's going on. Hey, what did I miss?
Yeah.
Yeah, always go back and check.
Yeah. Okay, so the next thing is called OSA, obstructive sleep apnea. And obstructive sleep apnea is another contributing factor to brain health. Now, Michael and I learned about this because we help people prevent and even reverse early Alzheimer's. And one of the things is if people are snoring or if they're not getting enough oxygen into their brain, then their oxygen levels go below a certain percentage. And then your brain is essentially kind of like having little attacks, oxygen deficiency attacks. And then parts of your brain can die off if you're not getting enough oxygen. So addressing obstructive sleep apnea is very important. What's it caused by? It causes you to stop breathing for short periods of time throughout the night, which robs you of restful sleep and great brain health. And the next day you feel like you're dragging, you're unfocused and forgetful throughout the day. Like, who needs that? This is something that you can actually deal with, and your doctor will be able to help you with this. Now, I did have a video to share with you, but we're not able to show it. So when we come back from our break, we'll go ahead and I'll talk more about the video and what the video would have shown. So I'll kind of explain it to you.
So is that kind of a kickover to me to say, hey, I think we're taking a break?
Well, yeah. Hey, we're taking a break.
Gee, did anybody catch on to that? They're taking a break? Yes, we're going to take a short break. And please remember, if you want to learn more about the MD and Chef team, myself and Isabel, please pop on over to doctoronamission.com. And that's where all our resources are, the abouts and all the goodies. And you can contact us there too if you'd like to. And we'll see you after the break.
Hello and welcome to The Edge of Greatness. My name is Charles Schultz and I'm excited to have you here. Come join me each week as we dive into what it truly means to unlock your full potential. Many experts like to claim that if you do this one thing or you do that one thing, that you'll find greatness. It's all about discipline. It's all about resilience. It's all about habits. I'm from a different school of thought. It has been my experience that greatness requires a more holistic approach. It's not just one thing, but 7 things working in harmony to create the full potential that you have. What are those 7 things? Purpose, mindset, resilience, commitment, discipline, courage, and people. Come join me each week to discover how each of these pillars plays an integral part in your success in discovering who you are meant to be. Hope to see you there.
Hello, I'm Dr. Isabel, and this is my husband, nutritional chef Michael. Did you know that your brain is your number 1 muscle? And when your brain health is in tip-top form, your life will be amazing.
We'd love for you to come join us in the Healthy Brain Club 12-week live coaching program. To learn more and to grab your seat today, go to doctoronamission.com under membership. Please keep in mind there's only 40 seats available, so grab your early bird access seats now.
Here's the deal. We know that medicine is happening in communities. We learn from other people's questions. The areas that we're going to be focusing on are nutrition, gut health, lots of hormones, sleep, exercise, and having the right thoughts.
So we'd love to have you join us in the Healthy Brain Club. See you on the inside. Welcome back. And in that last segment of the break, you saw us talk about our Healthy Brain Club. You know, it reminds me of a quote by Albert Einstein where he said, "The peak of insanity is continuing to do the same thing over and over and expecting a different result." Well, if you're somebody that's in a point of life where you think, you know, physically, mentally, all my different health aspects that I'm at a point where I know there's more for me. I know there's an optimal me out there. Well, we'd love to have you come and join us in a Healthy Brain Club. You can come learn more information about that on doctoronamission.com/membership. Pop on over there, learn more, get the details. And if you got any questions, please ask it. Otherwise, we'd love to see you in the club.
And in the club, I also like to emphasize,
Yes.
this is one of these places where we're there week after week. It's not going to be like we're there the first week and then we're gone and there's other coaches. We're like there working with you. Just like I said, Michael and I walk alongside people because you know what? When you create relationships with other people, they grow. And that's what it's all about, is creating relationships with people, listening to people, and helping them find their strength. So Nick Umbel said, I found out a year ago I was having 84 episodes an hour. My CPAP was life-changing. Nick, I am so glad that you got that taken care of. Can I ask you, what made you go and seek help? What happened? Did your wife say, hey, you're snoring too much? So if you can, just get back to us, that would be great. Because there you go. There's help.
Yeah.
So I just wanted to share that about the live Healthy Brain Club 12-week cohort. We're there.
Yeah.
We're there.
Mm-hmm.
And it's only for 40 people because we can only work with 40 people at one time. But that will increase with time.
Yeah.
Right?
Yeah, we'll see how we go.
Right, buddy?
Yeah.
Okay. All right. So let's talk about sleep apnea and exactly. So with sleep apnea, you can get cardiovascular problems like high blood pressure. So that makes sense, right? because you're having less blood flow to your brain. If you're having less blood flow to your brain, you're having less blood flow throughout your body, throughout your heart, and your blood vessels constrict. So you need oxygen in your blood vessels. Obstructive sleep apnea also has been linked, like I said, this is how we learned about it, with dementia of the Alzheimer's type. Alzheimer's, okay? So we don't want that. It also affects our focus, our learning, and it increases our risk of even having Parkinson's. So that's why we're talking about it. This is like a subset of the sleep. So how do we manage obstructive sleep apnea through interventions? Well, learning to breathe properly. How do you breathe properly? I mean, everybody knows how to breathe right from the beginning, right?
Yeah, that's kind of what we do from start breathing.
Well, not everybody gets slap time, just so
No?
you know. No.
Oh, you docs don't do that?
No, when I delivered the babies that I delivered for my patients, I never spanked them.
Okay, they
No.
just started crying right away.
Well, yeah, they start crying because they're like, hey, it's not safe and warm anymore. It's cold out
okay,
here.
yeah.
So they, just so you know, not
Okay.
everybody gets slapped.
So that's just
or
ones
spanked.
that are like, I'm not breathing. Hello.
Right. Well, then you kind of have to go, hey, but you don't
okay.
go like this because you don't want to shake a baby.
Yeah.
So you do kind of,
Give them a little.
you move them
I know, it's not
around.
a spank.
You're going like
Yeah,
that.
You're trying to warm them up, get them going.
You're stimulating them.
Yeah.
To
There you
breathe.
go.
So one of the ways is you want to make sure that you're breathing through your nose instead of your mouth. And that, because the nose hairs, the nose hairs are important. They help you filter out dust and allergens. And actually breathing through your nose increases oxygen uptake. And it also humidifies the air you breathe. So mouth breathing may increase your risk of bad breath, inflammation in your gums, and infection in your gums. So here's what we know. Michael and I have been taught that dementia of the Alzheimer's type, part of it is you start getting infection in your gums because you're breathing through your mouth. And so those infections in your gums actually affect your brain health because the mouth is close to the brain. So having poor gum health and poor dentition, teeth, really can affect your brain health. So please make sure that you're seeing the dentist and just getting your gum depth checked. And you can get that done by having the dentist. I know I didn't have it in my notes, but here I go.
Like we're going off
well, I know, but it's
we're over
part
here
of
on oral health now.
because this
I
affects
know
this.
it's
It's all together,
once
okay?
you start trying to compartmentalize it doesn't work because it all ties together.
So you see, you don't have to see the dentist and a neurologist. You just see one doctor that helps you take care of everything, and that's why we do what we do. So anyway, so you can go to the dentist and get a perio chart. So a perio chart is like a little
Well, yeah, they take a little pick and they put it down in between each tooth to measure the gum depth.
Right. And any gum depth greater than 3 millimeters is dangerous because that allows for pockets of infection, bacteria to grow in there. And then it can get deeper and deeper and it can cause dementia.
It's a contributing factor to Alzheimer's.
Right.
Yeah.
So go to the dentist and get your perio chart done. And also you can also, if you're seeing a functional medicine doctor, you can also get a mouth swab called an oral microbiome, and it tells you the bacteria in your mouth, and it will help you understand which bacteria are deleterious for your brain health, dangerous for your brain health. Also, addressing physical obstructions like tonsils or adenoids. Sometimes what happens, I forgot to explain the video that we weren't able to download. Sometimes when we sleep on our back, if you've got a short chin, you don't have to be obese to have sleep apnea, okay? Thin people can have it. But if you have a short chin or a small jaw, if you're sleeping on your back, your windpipe gets obstructed. And so your tongue covers your windpipe. And if that's happening, you're not getting any oxygen. So you want to make sure that you get that checked. You know, if you've got large adenoids, they might need to be addressed. And make sure you sleep on your side. Okay, that's important, because with sleep apnea, it's a big issue. And a lot of doctors don't really learn about it. I didn't learn about it in my medical training. There, like I said, you haven't heard me say this, but there is severe poverty in brain health education in the medical profession. We're not taught about the importance of mouth care and our brain health, about obstructive sleep apnea and our brain health, gut health, sleep, nutrition, hormones, the importance of past traumas and how that affects our brain health. So that's why we're so excited about what we're doing. Now, I just want to share something that Michael and I are doing that we've just learned to do. You may want to consider this, but you know how you want to be sleeping with your nose and breathing through your nose? You can actually get this tape to cover your mouth so that it's closed and you're just sleeping with your mouth taped and you're breathing through your nose. And studies have shown that you have more energy, you sleep better. I personally wake up more energized and I'm sleeping better. And you, my dear, are definitely not as loud.
And I'm going to put my hand up on this whole thing, because when Isabel first suggested this, I was like, this sounds like some kinky, weird thing. You know, I mean, taping my mouth shut. No, seriously, I did. I mean,
did
it was
you?
Like,
you didn't tell me that.
Well, I didn't knew you weren't doing it for that purpose, but I knew you had a purpose of it. But it was like, oh, weird, tape my mouth shut during the night. You know, I mean, but it sounds weird. We're not just always taught to think like this, but I can guarantee you, if you do your research, look out there. There is heaps and heaps of products on the market that you can purchase that have different sizes of patches and pads, and you put them on at nighttime. There's different styles and different pricing in that. So I've seen the ads on social media. There's also all over, the internet of these different pads now. They're very popular out there because it is a big deal. And for both of us, when we started doing this, we're having amazing nights of sleep and waking up in the morning feeling
ready to go.
Well, yeah. Tigger, T.I.
double go,
if anybody knows Winnie the Pooh, is ready to go in the morning. But Isabel, it's really helped for sleep. I've always been a good sleeper, but what it's done is it's stopped me from doing any kind of snoring during the night. And I notice also
because you have a shorter chin and you have a shorter neck and a smaller chin, so you're more apt to.
Yeah.
And then you sleep on your side, so that helps you a lot.
So I know for me personally, it's helped, but it has helped for both of us. So if it sounds kind of weird, I get what I'm saying is if it sounds kind of weird at first for you, I get that. But just know that this is right now new medicine and very popular. Lots of products on the market for it. Do your research. But yes, it does work. It does help, and it's important.
So
how was that for my?
That was really good.
Commercial? No, I'm not affiliated with any mouth company.
And unfortunately, these things that you're seeing, like for sale, they're expensive. So I'm going to share with you what we're doing. You can go to the chemist or the pharmacy and ask for the thinnest Hyperfix. It comes in a roll. It's Hyperfix. And like I measured Michael, and Michael's 6 centimeters and I'm 6 centimeters, and still the smallest Hyperfix, it's a white tape that we put on wounds, but still the smallest one I had to cut in half and it just shuts our lips and we're all night long. The reason we had to cut it in half is because when you use the full smallest width, it still covers the top of your lip. And Michael was getting irritated over the top. So he'd wake up with a little bit of redness. And then with the shaving, he'd end up trimming, cutting off half his upper lip.
Different styles for different people.
If you want to save some money, here in New Zealand, it's only $20 for a huge roll. So compared to what we're seeing. And on that note, my biggest fear is being naked during an earthquake with the Hyperfix on my mouth. So
outside and making shoes, lamp, and tape on your mouth, and they'd be like, "What the heck goes on in that house?"
because there's so much earthquake in this country. It's like, stop.
Hey, come on now.
Okay,
You're
so
having
back
way too
on-
much fun.
So back. Okay. All right. All right. So let's.
Such big fears in life.
Well,
I know.
that's what goes on under these curls, believe it or not. Okay, so I just wanted to say identifying and treating obstructive sleep apnea in patients can thus play a crucial role in promoting overall brain health and reducing the burden of neurodegenerative diseases like I said, Alzheimer's and Parkinson's. Untreated untreated obstructive sleep apnea triples the risk of depression.
Hello.
Mic drop.
Mic drop.
And it also makes it harder to lose weight. Mic drop. So symptoms of obstructive sleep apnea in children and adults: frequent and loud snoring and snorting. Do you want to snort for us?
No, I'm not going to snort.
Just think of a pig.
Yeah.
Pauses in breathing, choking sounds, and small gasps for breath. Frequent open mouth breathing. Agitated sleep, moving around a lot, like flailing in bed. And I just want to say, I believe in God, and he's so smart when he created us. The reason we're moving around is because if you're not getting enough oxygen, your brain says, move, move. And so that's why you're moving around, to change positions to help you breathe. He's so smart.
Yep.
Excessive sweating, and then also, but wait, there's more. Abnormal sleep positions, like sleeping, sitting up, or with your neck hyperextended will cause it. Symptoms will also be night terrors in children. If your child is waking up having terrible nightmares, you might want to talk to your pediatrician. It can also lead to sleepwalking, bedwetting. I was never taught that. I always thought if a child is bedwetting, well, you have to think about urinary tract infections. I never thought of sleep apnea. Morning headaches, which makes sense. If you're not getting enough oxygen to your brain, your blood vessels are going to constrict.
Yeah. So if you're someone that's waking up in the morning and having headaches, this should be something to look at.
Right. Poor appetite, waking up with a dry mouth because you're breathing through your mouth, and early morning waking because you've just had enough. So I wanted to I'm going to bring up in just a few moments a questionnaire that you can look. You can just Google the questionnaire, but I want you to take it seriously because this is not just for older people. This is for all people.
So we'll address this after the break because that's a great thought.
Are we going to have a break now?
Yeah.
Is it time?
Well, you want to do that.
I thought we could do it before the break. Yeah. Okay.
Yeah.
Okay.
So I'd say we take a break now, and then we'll do that when you come back because then you're fresh, ready to deliver, and away we go. Okay?
All right. Thanks, Bev. Thanks for knowing what we're doing with our
So we're going to take a short break now. Remember, if you want to find out more about us, doctoronamission.com is the place to come on over to. All righty. We'll see you after a short break.
Hi, Joel Maurer, founder of Dink Ninjas. Dink Ninjas was dreamed up and started right here in Austin, Texas, a dynamic pickleball community. We arm pickleballers with the paddles, apparel, and accessories to dink like a ninja. Dink Ninjas is dedicated to supporting mental health awareness and cancer research. Shop our full lineup at dinkninjas.com and enter code NGBNTV for 10% off site-wide.
Hey, I'm Micah McCreary,
And I'm Rich Fry, and welcome to Truex Outdoors.
the ultimate outdoor show.
So come tag along with us as we experience thrilling adventures in hunting and fishing.
From the mountains to the rivers, we'll bring you the most action-packed outdoor experiences.
Watch us now on NGBN TV.
Truex Outdoors.
Hello, welcome to Veritas. I'm your host, Adam Colazetti, and I'm here to guide you on a meditative adventure like no other. Join me and lose yourself in your imagination as we travel the outer reaches of the cosmos, quest for powerful talismans, and explore the inner realm of your subconscious. What might you find along the way? But be warned, fair traveler, this path is not for the faint of heart. On this path, of one thing I am certain, dragons be here. Are you ready?
Hello, I'm Dr. Isabel, and this is my husband, nutritional chef Michael. Did you know that your brain is your number one muscle? And when you take super good care of your brain health, your life will be amazing.
We'd love for you to come join us in the Healthy Brain Club 12-week live coaching program. To learn more and to grab your seat today, go to doctoronamission.com under membership. Only 40 seats available. Early bird access now. We'll see you in the club. Welcome back, you healthy brain enthusiasts. Great to see you back here. Now, in that last part, you saw Isabel and I talk about the Healthy Brain Club. And you may be asking the question, well, what's my return on investment in that club, the ROI? Well, from a time point of view, what Isabel and I have done is 30 years of personal experience, 30 years of mentorship working with mentors, 30 years of research. And we've taken all that and put it into 12 weeks. So what we're doing is saving you time of, we don't want you to take 30 years to learn what we had to learn and go through. So we have it in a 12-week program. And also it saves you from going all over the place, trying to find all the information on all these different things that have to do with a healthy brain. It's saving you time. And then also financially, what we're able to do with this is long term, when you look at your health, this will save you on doctor visits, hospital visits, because we're hearing that so much from people, how many times they're in and out of the hospital, how many times they're seeing their doctors, and how much money is being spent on all that. We're going to help you to have a healthy brain so you don't have to go through all that so much. And then also from an investment point of view, it's just going to help you to be more successful in everything you do in life, because it's not just career and finances and everything from relationships to all that you're looking to achieve, because your brain is optimal and functioning so well into your last breath. So that's what we feel we bring with the ROI of the Healthy Brain Club. If you want to learn more, just pop on over to doctoronamission.com/membership. Check it out. We'd love to see you in the club. All righty. So now I know you have something, because it's going to be today's big take.
Okay, can't help but dance to that music. So there's this questionnaire that we're going to go through, and it's called the Stop Bang questionnaire, and you can Google Stop Bang. That's BANG. I don't know why they called it Stop Bang, but Jenna, could you pull up the questionnaire, and I'll show that to people and we'll go through it
so everybody can see the name there. So if you want to
Stop
learn more
Bang.
about this, just look up Stop Bang questionnaire. There we go.
Oh, here it is. That's why they call it Stop Bang. Screening tool for obstructive sleep apnea. So that makes it all right. Stop. Yep. All right. So number one, so if you can actually get a piece of paper and a pen, or in your mind, just decide how many points you get. But if you get 3 or more, then the next recommendation is to go see your GP or your family practice doctor or your internal medicine doctor and ask them to get you referred for a sleep study. The sleep study will help check how many episodes of oxygenation you go below a certain point. I think you're allowed only 5 episodes before you go anything less than you need treatment. And there's so many types of treatment. There's mouth pieces that you can get. You can get CPAP, which is a machine that you put over your nose and helps you breathe. And they've got the quiet type now too. It's not like the loud. Yeah. And just to bring some clarity on that, just like our friend Nick had as a comment earlier in the show, he talked about finding out that he was having 84 episodes per day and per night. And so he did something about it, got that taken care of.
So this is really just to understand that I might be having all this going on and I don't know, and I'm setting myself up for some long-term problems. So that's why this is so important.
Yeah, and don't be ashamed, because this happens.
Well, there's a lot of it out there.
There's so much out there, and we want you in tip-top brain health capacity for the rest of your life, okay? Oh, Jenna says that there was one question. So why don't you just go ahead and bring that question up, because that's more important. How do you stop being a mouth breather? Great question. I had recommended you can go to the chemist, or you can go to the pharmacist, and you can get this tape called HyperFix. It's HYPERFIX. It's a white piece of tape that we use as medical professionals on wounds, but it's very powerful. Is it powerful?
What, as far as adhesive?
Yeah.
Well, yeah. I mean, not that much.
No,
Really.
but it keeps your
mouth close.
And so it comes in a roll, and then definitely getting some. Thank you. Great. Yeah, the tape. So that's a good way. There's a lot of things online, that you can pay, but that's the least expensive that I found.
And I was at Nanamona. I was definitely breathing through my mouth at nighttime. I mean, I would even wake up hearing myself being like, but ever since I've been using that, I mean, I found I didn't need to be doing that, but for whatever reason, that's what was happening to me during the night. Now I don't do that anymore. So that's very, very, very beneficial. Let's put it that way. Alrighty. So stop bang.
So the stop bang questionnaire.
Stop bang.
Yeah. That's why it's stop bang. Okay. So Michael has just pointed out to me, the reason it's called stop bang is because S is for snoring, T is for tired, O is for observe apnea, P is for pressure, B is body mass index, A is for age, N is for neck size, and G is for gender. How did I make it through medical school? I don't know. You know how I made it through medical school? Because I am like a dog on a bone, and when I want something, I will not let it go.
A lot of studying, a lot of mentorship. You had some great mentors.
Yeah, and people that believed in me.
Yep.
Like you.
Thank you.
So I'll just go through the questionnaire, and then you guys decide, what number you are. So snoring. Do you snore loudly? Louder than talking, or loud enough to be heard through closed doors? Yes or no? Tired. Do you often feel tired, fatigued, or sleepy during the daytime, even after a good night's sleep? O for observed apnea. Has anybody ever observed you stop breathing during the night? P is for pressure. Are you being treated for high blood pressure? That gives you a tick yes. B for body mass index. Do you have a body mass index greater than 35? Now, I don't go by, in functional medicine, we really don't go by BMI, but for this, it just helps you get like a number. And so you can get your body mass index by checking your height and your weight. You can do that in meters and in kilograms. And you can Google it and get your BMI. So you can get it.
There's many BMI calculators online. You can just put in all
Google.
your details. Yeah. Age and.
Yeah. And you can get your BMI. Yeah. And if it's over 30, that gets a yes. Let's see.
Over 35.
Over 35. Okay. So 36, 37, 35 doesn't count. But it's pretty close.
But yeah.
So age, are you older than 50? Neck size. You want to measure your neck size. Can you believe we're asking you to measure your neck size? Does your neck measure more than 40 centimeters around? If yes, what is the measurement? If it's greater than 40, then you put in a yes. And gender, are you a male? Apparently, males have more sleep apnea. And if your number is 3 or more, then see your GP and
get a sleep study done. It's important. There's many places out there you can find out about them. And it's just good to know. Am I having episodes during the night? And episodes meaning times during the night when my brain's not getting enough oxygen. And that's not good. Bottom line, that's not being very technical. That's just the truth.
Yeah.
No oxygen in the brain, episodes of that, not good.
Yeah, your brain starts dying off and you don't need that. And you don't want to increase your risk of anxiety, depression, Alzheimer's, and other chronic diseases. Okay? So let's not minimize the importance of taking good care of our sleep. I'm telling you, you get your sleep under control, tick that contributor for brain health upstream, then you can work on the others.
Right on.
So let's continue working upstream, preventing the downstream event. That's what we're here for. Okay, yay! Now we get to talk about marriage.
We're going to kick into our relationship chat. And today we're trying to talk about men and women are different. And Isabel's going to bring a medical perspective. Now look at this video. Here she's saying to this gentleman with all these bags, oh, look, honey, these were all on sale. Isn't that wonderful? And he's going, okay, can we just get out of here? Let's go now, please. Okay, that was my general overview of the video.
But it was on sale, babe. I saved so much money.
I know. I mean, hey, if you've ever heard that one before, I get it. Because I have heard that one before. And I've probably used it myself, too. I mean, I guess if we're all honest, we probably all used that before when, our significant other has something on and we say, oh, I didn't see that before. Oh, I just got it. But it was on sale. It was on sale. That's the emotional attachment to something. It's like, emotionally, I think it's okay because it was on sale.
We are more.
We all do.
We
that.
do that by heart.
We're emotional beings.
So let's talk about men and women and how. I'll shut this down because I got to buy stuff. Sometimes you just got to buy. Yeah. But not beyond your means.
Yes.
Okay.
Be financially wise, please.
Very wise. Be responsible financially, always and forever.
Yes.
And ever. So hormones. Women and men are different hormonally. Just so you know, all men and all women have the same hormones. Did you know that? Yes, we all have. Men and women, men have estrogen, women have estrogen. Men have testosterone, women have testosterone. Men have progesterone, women have progesterone. DHEA, vitamin D. Vitamin D is a hormone. Pregnenolone, just to mention cortisol, all those hormones, we all have them. However, men and women have different concentrations. So that makes us differently. That makes us different. And the reason I'm bringing this research up is because men and women are different. We are different. And my goal is let's just learn to dance together with our differentness, if that's a word.
Yeah. With our differentness.
With our differentness. And if it's not.
Are we different?
Yeah, we're very different. And then height, women on average are 7 centimeters shorter than men. And men are 7 centimeters on average taller than women.
Yeah, okay.
And then verbally, women I didn't know this, but when I did the research, women start talking earlier and are generally more sensitive communicators. I didn't know that we started talking earlier.
I think I've heard that, yeah.
Have you?
Yeah, in research, yeah.
And men only speak when they have something to say. They have fewer words.
And how many words a day have you
found?
Women,
get this, women speak on average 20,000 words a day. And men speak about 7,000 on average. Gosh, that's almost 3 times. We talk 3 times more than you guys.
Yes. But that's because
we're different.
We're such great listeners.
Okay, yes.
I'm going with that one.
Yeah.
But that is a key, though, guys. If that's what the research shows, understand that
there's a reason for it.
If your wife, your significant other, your girlfriend, your partner, if she's speaking 3 times more than you, and that's just the way it is, understand that and know that, well, then I need to learn to be a good listener. Doesn't mean that you can't learn to be a good listener, but it means definitely for us guys, we need to learn to be a good listener. And so that's a real key in a relationship is learn to.
And how have you learned to be a good listener? Because you're an excellent listener. What do you do to listen well?
Allow you to talk about what you want to talk about.
Mm-hmm. And are you on your phone when I'm talking?
No.
Are you
paying attention?
Are you on Instagram?
No. It's about paying attention.
Are you doing paperwork on the computer?
No.
I know you give me your undivided attention, and I do the same for you.
Yeah.
When you're talking to me and I'm in the kitchen, I stop what I'm doing in the kitchen and and look at you instead of doing what I would love to do, and that is continue doing my task.
Yes.
Right?
Right.
Yeah. But I've had to learn that.
Yes.
Right?
Yes.
Because when I don't do that, I'm not showing you love.
Correct.
No, really, hon.
No, I know. You're right.
Yeah.
So we are different.
Yeah.
Just understand that, on average in the research, women will speak 3 times many more words during the day than the guys. And guys, we need to learn to be a good listener. Living at high elevation. What did you
actually, great question, Rubio. So
Great
Rubio
question.
said with the whole oxygen to the brain issue, this might be a dumb question. No dumb questions, Rubio.
That's a great question.
But does living at higher elevation harm you? Actually, your body is so smart that your red blood cells actually latch on more oxygen. So we learn, our body acclimates, when you're at high altitude, but it takes a couple of weeks to do.
Yeah, you adapt.
So you adapt. So it's not that the people that are living at high altitude are more demented or more anxious or more depressed or more obese. Your body is just so smart, and the red blood cells catch on more oxygen because it's your red blood cells that give you the oxygen for your brain.
Yeah, thank you for that question, Rubio. Great question. Because we lived in Colorado for 20 years, so we had to think about that too. Well, I wanted to continue this discussion more.
Me too.
But we are starting to run out of time. So thank you so much for everyone that's come by. Please know that we're here for you. We will be here for you. Thanks for hanging out with us. We'll be back more to hang out with you, to have some real conversation around brain health, physical health, mental health, your overall goodness of you living life at your optimal. If you want to learn more about us, you can go to doctoronamission.com to learn more about us, or on social media, look for @DoctorOnAMission at your favorite social media channel. And that's it today. We are out.
Over and
Peace.
out. Bye.